student nurse today. Let me go ahead and go in and get some gloves on really quick, okay?
They can still do walk-ins, I'm pretty sure. Like, you can walk up and just be like, our face with some form of show you like this to
Alrighty, can you confirm your name and date of birth for me? Okay, and do you have any allergies? Any allergies to latex? No? Okay. For my wristband, let me just make sure that the bed is locked. Your side rails are up. Okay. Alrighty, Mr. Johnson. So today the doctor has ordered an NG tube for you. And what that is a tube that is going to go into your nostril, down your throat, into your stomach. And it's going to help relieve some of that distension that you're having right now. We're going to attach you to suction so you can take some of that air and gastric juice out. And we can also use it to administer medications, okay? It's not the most comfortable procedure, I'm going to be honest with you, but I'm going to do my best to do it as quickly as I can. And I'm going to give you a cup of water that should help relieve a bit of that irritation. It should help get that tube down a little bit smoother, okay? Do you have any questions? No? Okay. Let me go ahead and give you some privacy. And I'm going to gather my materials, okay? Alrighty, Mr. Johnson. I do have some questions for you. Have you had any facial trauma before? Or have you had any nasal surgeries? No? Any nasal polyps or congestion that you can think of? No? Okay. I will check in a second to see which nostril I want to use, okay? Go ahead and set this up. Here's your cup of water, and what you're going to do with that is you're going to take little small gulps whenever I instruct you to as I'm progressing the tube down your throat, okay? Just get my light, and I'm gonna look to your nose. If you could tilt your head up. Just gonna look through your nostrils. Okay. I don't see any obstructions. And that's what I'm gonna do is I'm gonna use my finger to block one of your nostrils, and you're gonna breathe in, and I'm gonna do the other one, and that's gonna help me pick which one I want to use. Okay? All right. So let me block this one. Breathe in. Perfect. Next one. Okay. I think we're gonna go with our left nostril, okay? Alrighty, let me just, next, I'm going to measure. I'm not gonna insert it just yet, okay? Let me raise you up just a little bit. Make sure that you're, is it okay if I lift you? You're not in any pain? No? Okay. Okay, so not inserting it just yet. I'm going to measure the tube so I can see how much I need to insert it, okay? And I'm gonna measure from the tip of your nose to your earlobe down to your xiphoid process, which is on your chest. And so with that, I'm going to need to expose your chest. Is that okay? Yes? All right. Go ahead and first measure. Make sure it's not hitting your face. Measure from the tip of your nose, earlobe, and then here I'm going to expose earlobe down to xiphoid process. Alrighty, let me go ahead, hold that with my finger, cover you back up, and we are at 46. Let me just go ahead and mark that so I can remember how far to insert it. There we go. Set this aside really quick. And I'm going to put this on your chest, so just so that we can protect your gown and it can catch any fluids that might come out. So let me just set aside some tape, and this tape is going to help attach that tube to your nose, okay? I'm going to give you this emesis basin. If you do become sick, you can go ahead and do that in there, okay?
From your nose to your airlock and then to your diaphragm crest, I'll have to lift up your gown a little bit if that would cover you.
Okay. Let me go ahead and lubricate this before we get started. Okay, Mr. Johnson, I'm going to have you tilt your head down with your chin towards your chest, and that's going to help open up the passage that the tube needs to go through, okay? And you have your cup of water, and you're going to sip whenever I instruct you to, okay? Alrighty. Now let's go ahead and insert. Sip, sip, sip. Here you go. Sipping, sip, sip, sip. Perfect. Alrighty, Mr. Johnson, we're in. That was the most uncomfortable part, okay? We're a little tangled up. Just gonna set this in here to catch any gastric juices that may come out. I'm going to attach the tube to your nose so that it doesn't come out, okay? And if you do begin to experience some irritation with the tape, just go ahead and let me know, okay? 46, part inserted. Alrighty. Okay, we're gonna leave that bin there for now, okay? I'm going to go ahead and take out some gastric juices just to make sure that we have correct placement. This shouldn't cause any discomfort. It might feel a little funny, okay? Go ahead and get some out. Okay. I'm just gonna test it to the scale, and it is below 5, which indicates that we are in the correct spot. But just to make extra sure, we're gonna get an x-ray to make sure that the tube is in your stomach, okay? Alrighty. X-ray has confirmed that we're in the right spot, so I'm going to attach you to suction, okay? Well, I would have cleaned up in between. Let me just set this aside. Go ahead and first, let me remove this, get it out of the way, or let's wait until we connect to suction, just in case we have any little accidents, okay? I'm just going to check to make sure that the suction is working first. Turning it on, making sure everything is connected correctly.
We're filming.
Okay. Taking it to intermittent and waiting for it to turn on to double check.
Haley, what about here?
Yeah, that was wait. Oh, sorry.
Cool. Hey, it is at the correct level. So now I'm gonna attach the tubing. Oh, correction. I would attach it to the gown first to make sure that it's not in the way. Can I have you turn to your right, please? Okay, that's just to make sure that you have the correct range of motion. And I'm just going to attach it to your gown, okay?
Okay. Okay. And I would look.
Yeah, we can practice if you want.
And then now, after everything, I would attach the suction. Okay. I'm gonna go ahead and remove this now that you don't have the risk of a mess. You clean up. And then also Go ahead and clean your face up just in case you did get sick. Okay. Let me go ahead and turn that suction on, okay? Okay, Mr. Johnson, that was it for the procedure. Do you have any questions or do you need anything from me? No? Okay, let me just go ahead and lower you back down. Oh. Would you like some more water? Yeah? Okay, I'll grab some for you. And would you like to be lied back down a little bit more? Yeah? Okay, let me know when to stop. Right there? Okay. We are at about 45 degrees. If you want to lay back down a little bit more, we could lay you back down just as long as it's 30 degrees or above. So if you would like to lie back down, just go ahead and hit the call button, which I'll hand you in a second, and mirror one of the patient care techs to be over to help you lower it, just to make sure that it's not lowered too much. Okay? Alrighty. Let me just go ahead and change my gloves before I give you that. Do you have all your personal belongings near you? Yes. Okay. Oh. I should be back in about 30 minutes just to make sure everything is looking all right with the suction. And you should start to feel a bit of relief from that pressure, okay? Is this side for the call light okay? Yes? Alrighty. So here is your call button. Your bed is lowered to the lowest. Just making sure that the brakes are on. Side rails are up. Alrighty, Mr. Johnson. Like I said, if you need anything, you hit that call button, okay? Awesome. Thank you. I'll see you in about 30 minutes. Out. And I would have cleaned up and exit. Okay. For what I would document is I would document which nostril I put the tube into, how far I put it in, which was 42, and then the type of tube I used, which was the 16 French. I would document how the patient handled the reaction, that I used intermittent suction and that it was in the green, and that the gastric contents, what they look like, and the amount.